Let's begin with our next session, which will focus on laparoscopic suturing on board. This session will be conducted by Professor Farhan Zaheer. He is a prominent general surgeon, a prominent laparoscopic general surgeon in Karachi. At present, he is the head of department at the largest colorectal unit in Pakistan. Please give a warm welcome to Professor Farhan Zaheer.
Okay, my presentation would be continuation of what we have already learned in earlier sessions, and it is continuation of that. We have already learned about the handling of needles, and we have seen how knotting practice is done. And my session would be about tissue approximation and tissue handling. It was supposed to be done as a second step, but knotting practice was done earlier to that. So we are going to discuss about this at this session. Ideally, the suture length which is required for interrupted sutures is about 10 to 15 centimeters. If you take more than that, it becomes troublesome. It becomes difficult to handle. So there are certain principles in which are applied in tissue approximation. One of them is that the needle holder should be held parallel to the tissue in which suture has to be applied. The other one is that the needle has to follow the axial rotation of the needle holder. The third one is that the resetting of the needle, that is when the needle is grasped by assisting instrument and when it has to be transferred back to the needle holder, that is called resetting. That has to be done at the tissue level. It shouldn't be moved away from the tissue, and it should be done, resetting should be done at the tissue level. So these are the diagrams which will guide you how to approximate the tissue with the help of sutures on board. The first diagram shows that the needle holder is parallel to the tissue which is being held with the help of assisting instrument. It is slightly lifted. Needle is entering at 90 degrees, 90 to 70 degrees from the tissue level. In the second diagram, you see that the needle is following the axial rotation of the needle holder. Third diagram shows that the needle is grasped at point B by the assisting instrument. Now fourth diagram shows the resetting of the needle with the help of needle holder at point C. This is done at the tissue level, not away from the tissue. The fifth table, we repeat all the sequence on the other side, lifting the tissue with the help of assisting instrument, aligning the needle holder with the tissue, passing the needle through the tissue, following axial rotation of the needle holder, and again grasping the needle through the assisting instrument. So these are all the steps, and these are the principles which should be followed when we are reapproximating the tissue. ये चला दिया, इसको चला दिया, excuse me. This is the video which shows how it is done practically. Needle is grasped by needle holder at point C. Tissue is displaced in order to create some space. Needle is entered at 90 degree, 90 to 70 degree from the tissue. Needle follows the curve, grasped by other instrument, resetting done. Same technique is applied on the other side. And the aiding instrument, the assisting instrument now becomes a pivot. And prevents damage to the tissue by the thread. Next video. Please. This is another video showing the same process. Needle held at point C. Tissue is displaced with the help of assisting instrument. Angle of 70 to 90 degree is made. The needle is entered following axial rotation of the needle holder. Held at point B. Reset it again at tissue level. Again tissue is displaced and the sequence is repeated on the other side. The other instrument acts as fulcrum, acts as pivot to prevent damage to the tissue and pull the thread from the margins. So now we move on to the stations in order to perform this exercise. Okay? Move to the stations, please.